I'm going to talk about tuberculosis. 24th of March is the World TB Day, and the theme of this World TB is Invest to end TB and save lives, looking for the missing cases. So we start with what is tuberculosis. So this is a multisystemic disease with a myriad of presentation caused by Mycobacterium tuberculosis. Generally, 80% of the presentation of tuberculosis is oftenly pulmonary tuberculosis. So, because of its presentation from pulmonary region, the common manifestations will include cough, weight loss, and loss of appetite. You have fever, you have night sweat, you can have coughing of blood, chest pains, and generalized body weakness. So because TB can present in other ways, and so the other presentation you can present with the tuberculosis meningitis. You can have skeletal TB, you can have genitourinary TB, you can have gastrointestinal tuberculosis, and you can have skin tuberculosis. And so these other forms of TB, especially the extrapulmonary, can be quite challenging in making a diagnosis, and the health care providers should be on the lookout so that we don't miss out these unusual presentations of tuberculosis. So diagnosis of TB is mainly through sputums, where you can do the acid-fast bacillus staining. These days we have commonly also the sputum gene expert, and you can also do gene expert of other specimens, and also you have radiological investigations like the chest X-ray. You can have CT scan and also MRI depending on the presentation. And basically the good news is that TB is treatable with multi-drug combinations, which is taken for a period of 6 months. So there are groups that are highly at risk of tuberculosis, and they will present in unusual ways, and there are people that we need to be careful always to look for tuberculosis. These are patients with HIV infections, people who are intravenous drug users, patients who have problems with alcoholism, patients with diabetes, patients with any form of cancer, patients with end-stage renal disease, smokers, and children below age 5 years. So as we are looking for the missing cases, I would encourage health workers to be highly on the lookout, especially on this group of patients, so that we don't miss out the diagnosis. And I've said that TB is treatable, the prognosis is good, not many patients remain with long-term sequelae of tuberculosis. So thank you very much as we all join hands to treat and eliminate tuberculosis in our country and the world.